Thanks, Spark, for inviting me to speak on this important area. And so what we're going to talk about today is autism assessment. And we're going to talk about what it is and how do we get one, right? And to that end, what I'd like to cover today is how to initiate an autism assessment, when to initiate it, what to expect when you get there for the assessment, and talk about barriers to accessing an assessment. And in particular, the impact of cultural, ethnic, and socioeconomic factors on accessibility to an autism assessment. And at the end, I would like to speak a little bit about the importance of research and some of the barriers associated with access to research participation that's faced by ethnic and cultural minorities as well. To first provide a little context for our discussion, let me start with, in 2000, the CDC estimated that 1 in 150 children were affected with autism. And in less than 25 years, that number has gone to 1 in 44. Significant increase in the prevalence of autism spectrum disorder. Boys still remain 4 times as likely as girls to be diagnosed with autism. And about 1/3 of children diagnosed with autism also are diagnosed with an intellectual disability. Kind of give us some idea about the landscape, at least the basic landscape in which we are dealing, right? So we don't know a lot, to be honest, for sure. We know a lot, sort of sure. One of the things we do know without question is that the earlier we intervene, the better the outcome. There's absolutely no question about that. And certainly that's true for many things. And it is especially true in autism. So early diagnosis is a critical factor. Early diagnosis is often the catalyst to get access to appropriate intervention and services for kids, right? And again, by doing that, this allows the child to have the ability to reach their potential. And we see this improvement in development, if you will, across areas. So we see it in better language skills, better cognitive skills, better adaptive skills, better behavioral regulation ability across the board. And it also contributes to decreases in maladaptive behaviors and overall symptom severity. So again, and this, I will emphasize this throughout this talk today, early intervention is just critical, right? And along with the assistance it gives to the child, it also provides an avenue for families to acquire services and supports for them to deal with coping with having a child with a developmental disability. Raising children is difficult in and of itself. And then when you add on an additional layer of a child having a developmental disability, then you certainly increase that burden just with that fact. And so access to those there are services available to support families, and access to those services depend upon that early diagnosis. And conversely, without early diagnoses, we often see greater emotional and behavioral problems with kids. So again, earlier the better. So what should a parent do if they have concerns early? So one of the initial things that can be done is for a parent to raise the concern with the child's pediatrician. And many pediatricians today are routinely screening their patients for autism using some screening measures. MCHAT is used in particularly a lot. So they're screening kids at 18 and 24 months. And based upon that screening and parent concerns, the pediatrician can certainly and will often refer the child to a specialist for an autism evaluation. And these specialists consist of child psychologists, child psychiatrists, child neurologists, a pediatrician who specializes in development. So we're talking about developmental pediatricians, neurodevelopmental pediatricians, or the referral can be to an autism specialty clinic. And that includes a number of different specialties all in one place, for example. And we'll talk a little bit more about that later. And some of the things that should spark a parent's attention early on when it comes to developmental concerns include things like a child is not responding when their name is being called. There are speech delays, and that speech delay is a common concern that is brought up by parents initially. But there are speech delays, or there is some abnormality in the way the child is communicating. So for example, they're engaging in echolalia, they're repeating things that are said to them, or they are repeating things they see in movies. If the child is over or under responding to sensory stimuli, can be a signal for further evaluation. And this is to things like light, sound, texture, those sorts of things. If the child is becoming extraordinarily upset to small changes in routine, driving a different route to daycare center, or any change in basic routine, and or if the child is engaging in unusual, repetitive, what we call stereotype behaviors, such as body rocking, hand flapping, or spinning, those kind of things. So these kind of one reason I bring these things up is that these things touch on the fundamental areas that we have identified as representing this thing we call autism, right? Like there are two main areas of disruption that we have characterized to represent autism. So one is a delay in the development of appropriate social communication and interaction. And then this other broad area of repetitive, restricted interest that includes the sensory issues as well. So these things highlight those central kind of areas. Now, above and beyond that, it is helpful for parents to have an understanding of what we are characterizing as typical development. And this is not intuitive, right? Like it's not known just because you're a parent that you know what typical development is, especially when it's your first child. There are resources available to get this information. CDC has a website that lists developmental milestones, when they should occur, and CDC even has a tracker that you can download, and you can track your child's development and be alerted if, in fact, they are outside the realm of typicalness, and who should be alerted in terms of further evaluation. Spark also has information on their website about development, and it is helpful to have an understanding about what is typical. And one of the things I think is really informative is to observe your child in natural settings, if you will. So observing them with their peers, either formally in daycare, for example, or informally at the park or at parties and this kind of thing. That can give you a real sense of where your child is relative to other children their same age. I find that to be a powerful mechanism, if you will. So in my practice, I see a lot of kids with challenges naturally because they've come because they have things, and it is always a great recalibration for me when I see a child who doesn't have developmental delays. It kind of recalibrates me to get back to, okay, this is what is to be expected when not, because you kind of lose sight of what is typical and what is not. So, and it's important to know that for you to be able to bring up concerns. And we're going to talk a little bit more about this later, but I want to point out now too that if you raise concerns with your pediatrician and the pediatrician doesn't share those concerns, they suggest waiting, for example, or suggest no major concern for whatever reason, certainly I encourage parents that if you're worried about your child, trust your gut and continue to seek more expert support if you think there's something warranted to be looked at, regardless of what any of us so-called experts say. You know your child better than we ever will know them. So if a pediatrician initially doesn't want to, for example, if a pediatrician initially doesn't want to offer a referral, it's certainly okay to ask for one anyway, and go ahead and do that. So that being said, once you do get a referral, then you are faced with the fact that after getting the referral, you now have to wait weeks, even months, and in some cases years before your child will receive that autism evaluation. And that's a problem, right? And so I encourage families not to wait for that evaluation. There are other things that can be done, and these are important things, and you're really not losing any ground in terms of getting what your child needs. So one of the things that can be done is you can contact your early intervention program, and that through those programs, your child can receive a free evaluation around their development. And even more importantly, if delays are found, they can begin to receive services through these early intervention programs, right? And so, for example, if your child is under 3, contact your infants and toddlers program, and they can do an assessment and again provide therapies around a number of challenges your child may have. And these therapies are often available at little or no cost and delivered in the least restrictive environment. They can be delivered at home, they can be delivered at school, they can be delivered in the community as well. And if you don't know where these organizations are, again, CDC has a website that lists these offices by states. They're all over the country. And you can find information about where your local office is, and you can contact them. If your child is 3 to 5 years old, you can contact your local child find office. And or, as the CDC suggests, call any local public elementary school. Even if your child doesn't go to school, it doesn't matter. and you tell them you have concerns about your child's development and you want to have your child evaluated for preschool special education services. And if your child is in school, anywhere from kindergarten to 12th grade, you can contact your child's school and tell them you want an evaluation. Importantly, because unlike clinics and doctors, early intervention and school officials must conduct evaluations and provide services within certain timelines. This is mandated by US special education law, so they have to do it. And remember, what's important early on is we want to identify any problems going on. And even more important than that, we want to start to intervene as soon as possible, right? And so the context of that landscape includes the fact that, so while schools can diagnose, and I have diagnosed in quotes because it's diagnosing autism or anything else in the context of an educational disability designation, right? Which is somewhat different from a medical diagnosis. We'll talk more about that in a minute. That being said, even though they can make an autism diagnosis early on, they typically don't anyway, unless the child has a previous diagnosis from a physician or a psychologist. They will typically use the term developmental delay. And that's okay, right? Like getting this early evaluation, getting services done is fine. It is okay. That is the more important thing. We can worry about labeling it later. But for parents to do this part for their child, you can feel confident that you're on track, you're doing what you need to do, and you're getting the services your child needs to get. So again, I employ parents, don't wait on that autism assessment, because again, that can take a while to get to, but you don't have to wait for that to get things done. That being said, at some point, labeling does become important, right? Like we need that diagnosis to get further services. And we need to be diagnostically clear on what's going on, because it drives our understanding of the child and it drives our understanding of what the child needs. So diagnosing does become important, but just not early on. But it does become important. And unfortunately, even though in the field we feel that autism can actually reliably be diagnosed by age 2, most kids don't receive their first diagnosis until after age 6, even still. And then on top of that, there are certain families, certain groups that carry an additional burden in that because they are, for example, an ethnic minority, their child receives their initial diagnosis even later than a white child will receive. And these data have been consistent for some time over the years now and continue to be consistent. And one of the things I want to point out on this slide that we're going to refer back to later at some point is that not only have Black children, for example, been found to receive the diagnosis later, they've also been found to require 3 times the number of visits as a white child before they get the diagnosis. And again, data consistent over the years that this continues to be a problem, right? And some of the kind of variables associated with this disparity have been identified. And part of the reason I'm highlighting these is for families to be aware of what may be impacting a health professional's interpretation of your child at any given time, so that you can not only have an understanding of that, but you can then plan ways to kind of ameliorate that effect with this knowledge. So studies have demonstrated that when a child, let me say it this way, the more impaired a child presents, the more likely they are to get the autism diagnosis. So we have been fairly good at catching those kids who, regardless of ethnicity or culture, those kids who are the most impaired, if you will. It's when they are less so is where the problem comes in across race and ethnicity, with a larger impact on those kids who are non-white, right? And these data just support this idea that if a ethnic minority child is impaired, then they likely have an autism diagnosis. They're more likely to have an autism diagnosis as well. And again, the more subtle the symptoms, the higher the cognitive functioning, especially in early childhood, those kids get missed. And again, this is across ethnicity and culture. So this affects, this idea affects all families with a more profound effect on non-white minority cultures as well. Now, some of the variables that have been associated with this diagnostic disparity include health provider variables and parent variables. And some of the health provider variables have included, from parent report, doctors not spending enough time with their child, not listening to them carefully, or not making them feel like they're a partner in the process. And there's has also been some suggestion of misattribution of the child's presentation, for lack of a better way to say it. And we'll see some more data on this later as well. And one study pointing out that pediatricians had tended to attribute autistic features to language and culture rather than autism. Some of the parent variables that have been identified have been things such as Black parents reporting fewer concerns about autism-related symptoms, Black Latino families being less concerned or aware about autism and not seeking a diagnosis, and Black and Latino families having different perceptions of similar behaviors based on cultural background. And these studies, and I think it's coming more and more to light, have been convoluted with other factors. And I'll say a little bit more about that in a minute. And a recent study, Spark did a recent survey where they looked at, surveyed, asked questions of 400 Black, African American, and multiracial families within the SPARK cohort, right? And a third of these families reported that their experience was that race and ethnicity affected their overall experience with the health care system, with some reporting that what we've heard before, professionals weren't listening to their concerns, or that the autism evaluations were not culturally appropriate. And we'll have some more about that later as well. And so one of the things, let me go back to this previous slide, one of the things that I think may have influenced some of this earlier data and some of the data that continues to be brought in, I think there are a number of things. And one thing I think that has contributed to this is a less than appropriate appreciation for the impact of ethnic minority concerns, for lack of a better way to say. And one of those major concerns is fear and distrust of the system, right? And I think part of the impact of that has been over time, and is continuing to be, a hesitation of some parents to express concerns to a healthcare provider. And that can be driven by the idea that their child is already has something that will bring them discrimination. And so the idea of having something else placed on their child that will add another layer of discrimination their child has experienced is not always an easy thing for those parents to go along with. So I think sometimes things like that, and there are other things, but things like that can affect that interaction between parent and healthcare provider. But clearly, there's something going on that's driving this diagnostic disparity, right? And deeper than what parents are reporting or not reporting. And some of that has to do with, I think, deeper issues related to the broader society. And part of the data that kind of supports the suggestion of that are things like, so often by the time a minority child receives a diagnosis of autism, it's not that someone hasn't realized that something's going on, because those children often already do have a diagnosis. It's just not autism. It's another mental health disorder like conduct disorder or something like that, right? And so that suggests, again, a misinterpretation of the child's presentation. And earlier, we talked about kids presenting with profound delays and acquiring an autism and intellectual disability diagnoses. Those kids getting that autism diagnosis sooner than if they didn't have that presentation. Yet, studies have suggested that if a child presents with a pre-existing diagnosis of intellectual disability, then autism is not further evaluated in minority children. Another factor or variable driving this diagnostic disparity has been demonstrated or suggested to be economic status. So the higher one's socioeconomic status and the greater parental concern of initial symptoms, those factors have been associated with earlier diagnoses, right? Like the more money the family has, the earlier they're getting a diagnosis. And this goes along with the higher a parent is educated, which is linked to SES, to economic positioning. Of course, the more educated you are, the more money you tend to make. And so this idea that somehow socioeconomic status is driving the disparity, again, is a problem, right? Like that shouldn't be the case. There has been a recent study done by a group at Children's National Medical Center in Washington, D.C., and their study, the findings offer some cautious hope that we're moving in the right direction. And the take-home message from this slide is that, so let me back up a second. So they looked at a group of kids from an autism specialty clinic, and they looked at them as a group, and they split them up into two different groups. One group was older than 6 years old, and another group was younger than 6 years old. And so while on a whole, they still found these diagnostic disparities based on ethnicity, different symptom presentations resulting in different diagnoses, which is what this slide kind of summarizes. And the first part of this slide as well. The encouraging part was that they found that this distribution or discrepancy in diagnoses widened after age 6, which suggests that those kids younger than age 6 who had received more recent assessments, you didn't have that diagnostic disparity. So it suggests that maybe we have begun or beginning to look at these kids more evenly, if you will. And this supported some earlier work by Daniels and Mandel that saw a difference between older and younger cohorts in terms of receiving the autism diagnoses earlier. So it's encouraging, right? That we are moving in the right direction. Now, unfortunately, or even more unfortunately, even after receiving a diagnosis of autism, ethnic minority families, low SES families still face additional hurdles and burdens. The data has demonstrated that there are disparities in referral rates along with the diagnoses among these groups, right? And on top of that, lower quality services are being delivered to the non-minority groups. And certainly this is related to some of the broader social disparities we have historically and more contemporary in terms of insurance issues, and being on Medicaid and having fewer services available to you on Medicaid. Now, what this slide points out is that the significance, if you will, of the impact that goes beyond SES. And I think it's important that we understand that yes, there is an impact in SES, as we talked about earlier. The higher your SES status is, the better off you are in terms of getting diagnoses, in terms of getting appropriate services and all of that. And it is important to understand that dynamic of, so it's important to understand a couple of things. One is that the dynamics of that affects non-white children more simply because they are overrepresented in the lower SES group, right? So we're going to have more of those families proportionally affected by being in that low SES status. On top of that, however, what data has shown is that even within the lower SES communities, the racial minority children, the ethnic minority children, were still less likely to have received an autism diagnosis. They receive it later among the other members of that low SES communities, right? So even when you looked at the Medicare data, there were fewer Black beneficiaries receiving ASD-related services than Asian or white families. So again, I'm highlighting this additional burden beyond SES. And even more sadly, I was going to say sadly, but even more sadly, there was one study by Fontaine and colleagues that SES was a stronger predictor of receiving state services even more than symptom severity, right? So how impaired your child was didn't get you services. It was whether or not it was your SES status that predicted whether or not you got services or not. Which again, it's not right? Like these are things that are important for us as health providers, as researchers to address. Like I think, more than think, I know this is our burden to address these issues yesterday, right? And this slide just sums up kind of a dynamic that, again, supports this SES idea, and I'll just go over this quickly and rather briefly. So when they looked at prevalence of autism by socioeconomic groups, the finding was that prevalence rose evenly among the groups, right? And then they looked at the data more closely and found that white children, again, were more likely to receive a diagnosis than were Black children or Latino children, right? And then they looked even closer, and what they found was what was driving that initial finding, what appeared to be driving, a large part of what was driving the initial finding, was that it was the rate of Black children in the high SES group that was significant. And that pulled up everything else. So it wasn't all the Black children, the prevalence wasn't increasing in all of the Black children. It was increasing more significantly in the higher SES. So again, the effect of SES on diagnosis. Okay. So you're going through all the hurdles, you've fought the good fight, and you finally get to the assessment. Okay. And so what should you expect? So that appointment is going to look different depending upon who is conducting the evaluation, whether it is a physician or psychologist, or has the referral been made to an autism specialty clinic. And that will affect the duration of the appointment, right? Like depending upon who and where the appointment is being conducted, it could take anywhere from part of a day, most of a day, to across several days. So what happens is your pediatrician makes a referral for an autism assessment. And for example, at my clinic, we get that referral in, and we have specialists here. We have psychologists, physicians, speech language pathologists, occupational therapists, and we often do team evaluations. And depending upon the structure of the team, that will drive how the duration of the assessment. So depending upon the structure of your team, the assessment, again, can go from part of a day to all day to being across several days. I encourage parents to, when you get that appointment, ask questions about what your child will be receiving. Because again, what has happened is a referral has come in to us for an autism assessment. And then a group of folks are going to sit down and they're going to decide what that assessment should look like for your child, right? And again, that could include anything from just an appointment with a psychologist, just an appointment with a physician and say a speech language pathologist, or an appointment with all of those folks. Find out who is going to be seeing your child and what the purpose of that visit is, and what can you expect from that particular visit. Because one reason is because you may decide that you're not getting, depending on how we structured it, that you are not getting everything you wanted to get from this autism assessment. And if you're not, then voice your opinion and advocate for the structure of that assessment to be changed. And alternatively, you could be getting more than you wanted from the assessment. You could have been, your child could have been assigned for this multi-day assessment, and that wasn't what you needed, was a multi-day assessment. And so ask questions. The assessment is going to vary. It's the take-home message. It's going to vary. And so find out specifically what it is and what you are to expect from it. Now, what that assessment is going to look like more specifically is that typically a healthcare provider is going to use an autism diagnostic tool that involves observing and interacting with the child. So this is for the most part, not always. There are these special situations that is not used, but it's typically used. And what is most used is the ADOS, the Autism Diagnostic Observation Schedule. And that's typically done in a room with a two-way mirror that allows the parent to observe that interaction. And that can be incredibly helpful because afterwards the parent can provide some input on the nature of the interaction, right? Like you can be able to tell us, was that a typical interaction with your child? Was there something else going with your child? In addition, parents will be asked questions about their child's developmental and health history, as well as their behavior, emotional, and adaptive functioning. And this is often done informally, but can be done formally with a tool such as the ADI, the Autism Diagnostic Interview. But we definitely will be collecting that information as well. And if the appointment is with a psychologist can be in a position, and I say it like that because not all psychologists will be doing this, but again, you're going to find out exactly what it is your kid is getting. But psychologists are going to typically give your child tests to get their level of cognitive learning ability, memory function, and attention as well, right? Now, as we alluded to earlier, we've got a problem, right? The data have been clear over the years that something is amiss. We are getting these different symptom profiles based on ethnicity. And that shouldn't be the case, right? Autism is autism at its core basic level. There can be some culturally expressed differences, I think, at a higher level, but not at the base level, right? So we shouldn't be getting these types of variable presentations, right? Something is wrong. This is akin to the intelligence argument, right? That there's variability in intelligence based upon ethnicity. No, there's no biological data to support that, right? Like all of our brains are the same without question. And so for us to suggest that autism is a developmental disability, it should affect the same brains in the same way, again, at a basic level. So because we have these discrepant findings, we know something is wrong with our instruments. And we need to clean this up, right? Not only so that we are more fair, if you will, in terms of diagnosing across ethnic groups, but also to increase our understanding of autism, right? The more we all understand autism across whatever domain, the better we can understand autism and the better we can shape treatments and all of that. We are lacking in our understanding of what autism is. And this is in large part because the design and interpretation of these autism evaluation instruments is based on data collected from one group, the white dominant culture. And so we're taking those data and we're applying them to other groups. And when you say it out loud, right, it makes no sense. And it clearly does not make any sense. And it is critical that we clean this up. And to that end, we need more focused recruitment efforts directed toward non-white, underserved communities. Like, it's just, we need to do this like, again, yesterday kind of thing, right? And I think recruitment efforts should include addressing issues related to, specifically directly related to research participation, including trust issues and issues around accessibility to participation in research. And I believe that these efforts can be enhanced by several things. One, including more non-white researchers in the process, and creating collaborative partnerships with and providing more resources to these underserved communities. And to that end, I compliment and salute Spark for their DEI initiative. This is a bold and important step to ameliorating a lot of these problems that we have. And so they are Spark is leading the way, and it is, I can't overexpress the value in such a research initiative. And so we need to continue this work. Other people need to join in, and we need to clean this stuff up, right? Not only for the ethnic minority families, but for our broader understanding of what autism is and how to help these kids do it. So thank you very much for your time today, and I look forward to addressing any questions that come up. Thank you.
Thank you so much, Dr. Jones. This was really informative. And yes, we do have a few minutes left for questions, so we'll just jump right into it. So something, you touched on this a little bit throughout your presentation, but I think something that there was some chatter on Facebook, on the Facebook Live about is just why are African Americans getting diagnosed later?
There are several factors that have been identified as to what is driving this problem. One is, again, what we just talked about was the basis by which we are making the decision of whether or not a child has autism or not is based on our understanding of what autism looks like in a white child. And it can present differently in a non-white child. Well, we don't know that because we haven't done the research to understand, and we have not incorporated that understanding into the instruments that we used. And I think on top of that, there is, again, this larger, often unintended bias of interpretation by white clinicians, right? Like we see this throughout our culture in terms of a misinterpretation or a mismatch, if you will, in terms of interpreting another ethnic group's presentation. So I think those two things, along with things on the parent side that we touched on in terms of there are sometimes not a clear communication pathway on purpose because the family doesn't trust the system. So they're not willing to share everything. So in defense of the healthcare provider, they don't have all the information to make a decision. Those things, and along with the historical inequities that a lot of non-white families experience in terms of their access to care, I think all of those things are impacting on getting these diagnoses early.
Great. And then this is sort of a two-part question. So the first part is, are there preferred assessment interests to use when autism is suspected? For example, assessments that don't rely solely on verbal responses. And so part two is it better to have assessments done by a developmental pediatrician or a neuropsychologist?
Well, that's a great question. And so the first part of it, yes, there are different instruments based upon the child's level of functioning. And even within instruments. So for example, the ADOS has different modules, and depending upon, and the difference in those modules is largely based on language functioning. So direct addressing to your question. And so there's a module designed to do this assessment without depending upon language. Absolutely. So we have instruments specifically designed for that. And our training should lead us to be able to rely on things other than language to assess autism, right, as well. And the second part of your question, developmental pediatrician versus neuropsychologist. So I will put it this way. So one thing it depends on is complexity of presentation. The more complex the presentation is, I would lean toward a neuropsychologist over a developmental pediatrician. And not because one is necessarily smarter than the other. And of course, I think us neuropsychologists are, but not because of that, but more so because I think one of our largest advantage is the fact that our appointment is going to be the longest. So a neuropsych assessment is going to take all day. The more time I have with the child, the more I can get in there and kind of tease things apart and see what's going on. The developmental pediatrician is going to have 30 minutes, 45 minutes. And again, if there's a lot of complexity there, they just don't have the time to get at the information. Another reason you may want to have a neuropsychologist evaluate is if the level of cognitive function, if that is an important criteria or need of the parents to get at, then you need a neuropsychologist for that. You're not going to get that from a developmental pediatrician. So there are these different reasons for why you could go one way or another. That makes sense. Hopefully that answers your question.
Yeah, and I think just lastly, do you have any suggestions for where parents can obtain assistance with any burnout they're experiencing throughout this process?
Absolutely. So there are typically across the country parent support groups set up for that very reason, to support parents around this process. And these are individual, community organized kinds of groups, and then you will find them attached to your autism specialty clinic. So for example, here at Kennedy Krieger, we have a separate website that lists resources under various categories for families to get support. It's out there. Seek it out. It's a daunting experience. So yes, get the support. And you can get it again through autism organizations and general parent support organizations as well.